Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, we're sitting here in an old gas station, a really old gas station, but we're here with Dr. Carrie Muller, who is with Hoffman Animal Hospital over here on the Broadneck Peninsula. They're at 15 Old Mill Bottom Road, sort of tucked behind the BMW and the Mini dealership. And it's no longer a gas station, but it's a wonderful veterinary practice. How are you?
Good. Thank you for having me.
And if we hear any barks or meows or stuff like that, nothing to worry about. It's all part of the game. So how long have you been a vet?
I've actually been practicing for the last 8, going on 9 years. And traditionally, I have worked in emergency medicine, and then more recently has transitioned over to family practice, trying to create those client relationships, being able to see puppies as they grow from being a puppy to an older dog is very rewarding, as compared to the one visit here on emergency there and here.
Okay, I think that's pretty funny that you talked about emergency care and family practice, because you would normally hear that as with a human doctor, but I guess that's so true with the animals as well.
Yep, absolutely.
Where did you go to school for veterinary?
I went to school at Western University of Health Sciences. It's over in California.
Channel my father here, because he used to do this now. Did you get good grades?
I got great grades.
Okay. My dad was always the big one when he goes to see a doctor. He says, okay, that's great that you went to Harvard, but where did you graduate in your class? I'd much rather have the number one guy at a lower tier school than the bottom of the barrel.
That's so true.
But Hoffman Animal Hospital has been here for quite a while, though, hasn't it?
It has. We were formed in 1992 by Dr. Lisa Hoffman, and she privately owned it until very recently. So about 30 years we have been here serving the Annapolis area.
And is she still practicing, or?
She does. She is on a modified retirement where she gets to choose their days. She gets to come in, still kind of see the clients that she wants to see here and there, and then also cover for us. So we do very much enjoy when she comes in and spends the day with us. But for the majority of her time, she's enjoying her time over at Cape St. Clair.
Oh, that's awesome. I've talked to so many businesses that have started and have a long history, and the founder or the owner, or perhaps the second or third generation, whatever, is now retired, and they're always like, oh yeah, but they never retire. they come in, they stir up trouble, and they leave.
I wouldn't say that she's stirring up trouble by any means. No, we very much love having her here.
Well, I'll tell you, you work with animals all the time, and let's face it, that pets are family. In many cases, pets are probably preferable to family.
That is true.
To that, but now, what types of animals do you specialize in? Any types of animals here, or do you? Can I bring my horse?
No, we can't see your horse. Don't think we have the space for that. So we predominantly see dogs and cats. We can see exotics on an emergency basis. So exotics are your small guinea pigs or ferrets, but predominantly we're going to care for your dog and your cat.
I imagine that's probably very true of, that's the majority of the pets in the world.
That's true.
So with any practice there as well. Now, what are the capabilities here? You guys I took a quick little tour before we started talking, and it seems like you are a very small but mighty, as far as small but footprint.
Yeah. Yeah, no, that is a very good way to describe this practice. So it's Dr. Gostila and myself. So Dr. Gostila has over 19 years of veterinary practice, so very senior as well. And both of us are very capable of performing just general soft tissue surgeries, dental surgeries, periodontal surgeries, and then we're also able to do just the everyday preventative care. We're really focused on trying to keep these animals healthy so that way we don't have to do, extensive medical treatment. But we are able to hospitalize for the day, which is something that's very helpful for some of these animals that just need a day's care.
Well, you said periodontal surgery. Now that and stuff like that, is that a fairly new thing for animals? Like, the scaling and everything else. When I was growing up, okay, now granted that was a long time ago, but you didn't think about that. That was just crazy. But how important is that?
Yeah, that's a great question, and it comes up frequently, actually. And it really stems from the fact that we know more about animals now than we did back, 20, 30 years ago. And we didn't realize before that they can actually feel and they exhibit signs of pain from periodontal disease and dental disease a lot more than we're giving them credit for, because they hide it pretty well. And what we're finding is that if we're able to do the scaling, do that cleaning, every year to 2 years, depending on, what breed of dog or cat we're talking about, we can really extend their life by minimizing infection to the rest of the body, by minimizing inflammation in the mouth, and minimizing their pain and discomfort.
I had heard and recently learned this as well, but that teeth health is critical to humans as far as, and it's really connected to heart health as well.
Yes. And I think that's the other part of it too, is we're really understanding now how it's all interconnected. Even, when we talk about, different, GI microbes that are there, in humans, we know that different microbes can affect even how you feel, so depression, et cetera. And surprisingly, a lot of that research does come from the animal side. So as humans learn more, we get to learn more.
True. That makes sense. Now, again, back to the practice. I mean, you've got a surgery suite, maybe. That's what we're
That is what it's referred to. Yep. Good job.
But as far as, emergency surgery, okay, all of a sudden my dog just ate a hair tie. Not that a dog would ever think of doing something like that.
They do.
But, or something like that. That's something that you can handle?
That is something that we can handle. The limitations we have is we do not have overnight care. And so typically what we'll do is we will stabilize a patient. We will get them in a much better place from that emergent position to being more stable. And then once we're able to stabilize them, we'll transfer them over to an overnight facility. So that's a 24-hour care hospital. But yep, if your dog has an emergency, you definitely give us a call. We are able to really facilitate that, help them feel a lot better, and get them in a lot quicker sometimes than the emergency rooms are, because they're inundated.
Well, I've talked to several friends that have used in certain instances, and I'm going to draw a blank on the name, but there's one sort of tucked off behind Bestgate Road. They've said that it's like, of course, you're panicked. That's your loved one that's in pain or whatever it is. And it's like, okay, well, my gosh, I waited like 4 hours there. It's like, well, 3 minutes shorter than you would wait in the emergency room if you went to the hospital as a human. But that's, you sit there and you look, you're not 24/7 as far as
we are
working.
not.
Your website is hoffmanah.com,
Correct.
and that's one N in Hoffman. And plastered across the front of it, you've got a big old logo that says you are a fear-free practice, or a fear-free. Now, is that fear-free to the animal or to the owner?
Cool. Great question.
And what is it?
Probably both. It's really more focused on the animal. So that's another really great transition in veterinary practice over the last several years, is that we now have this certification for veterinarians, technicians, as well as our client service representatives to become fear-free certified. And so Dr. Gustila and myself are both fear-free certified. We've gone through that additional training to really focus on trying to create the vet experience with minimal stress as possible. And so that is by helping that animal understand that we are here to give them treats, we're here to give them love, we're here to give them toys as distraction, and then in some cases educating the client on how to train the animal to come to a place where they're desensitized. They don't really feel that stress of coming into the vet clinic.
Well, sure. Everybody, I think, knows, has the dog that says, come on, car ride.
Yep.
Oh, we're going to the vet. This is horrible. I'm getting a shot.
Yes, and so it's really focusing on the experience of the animal. So even as simple as the pictures we have up or the color of the rooms, we are starting painting to actually this week, which is super exciting, to change our colors over to something that we know that animals can appreciate as being more comforting and owners calming as well. The other part is we don't wear white coats because we know that white is a stark color for animals. They see colors differently than we do. And so no more white coats that you'll see. And we're on the floor with the animal. As soon as the animal comes in, we sit on the floor with them, and we don't want to lift them onto the table immediately because we want them to get comfortable with us and not feel that immediate panic of, I'm going to put my feet on a stark metal table. There's no metal tables here. So it's really focused on creating that experience from the minute they walk through the door to the minute they leave, and they're like, that wasn't so bad.
That's so cool.
Yeah.
And did you just debunk a the theory that animals are colorblind?
That's a great question because I don't think we can ask them, but based off of research, we know that they can see some colors, but they can see them differently than we can see them.
So we're in a room right now that's green and very pale yellow. You're looking at these colors, or maybe this room hasn't been done, but these are comforting colors for animals?
So this room hasn't been done. So this is part of that painting process, is that, this green color is probably interpreted differently to the animals than we are giving it credit to. So focusing more on the grays, the blues, those are soothing colors to animals and to humans.
Interesting. Interesting. Wow. What is the most common issue? I mean, we all have dogs and cats, and what tends to be the most common issue that you see? That I guess from a preventative type of a care and an emergency type of a care.
So I think for the preventative type of care, well, I wouldn't say preventative is the right word, but the most common issue would be allergies. We are definitely seeing a huge rise in dogs and cats having allergies. And we don't quite know whether in some cases it's environmental allergies, it could be a flea bite sensitivity, it could also be a food allergy. And I think what we're really identifying, particularly with the food allergy, is it's more associated with the protein than it is grain. I think a lot of media has really pushed the grain-free diets. That's going to be the best thing for your pet because they're not going to react. But more recent literature and research has shown that that's not the case. It's the protein in the food. And so focusing more on novel proteins that they may not have experienced yet. All food has chicken or beef. Those are the big proteins that we see that they can have allergies to. So switching them over to things like fish, rabbit, kangaroo, crazy things like that can actually make them be less itchy, and we don't have to deal with a lot of the ear infections that they're getting.
Now, is that like sort of a trial and error type of a thing? Let's change up the food. I mean, or is it? Or do you have let's irritate the skin and?
That's a good question. So we have both. For food, typically it's trial and error. So we're trying different foods that they may not react to as much. For environmental allergies, we do have allergy testing, but a lot of the times we focus more on treating the symptoms. So trying to remove that itch cycle with different medications that can target just individual cytokines or mediators within the body that stops the itching altogether.
Well, I know my Shih Tzu had getting a bunch of ear infections. It was a combination between he's low to the ground, the long hair, the floppy ears, the whole 9 yards. But when it would get bad, the itching and everything else. And we ultimately changed, which surprised me, but it was changed up the food.
Right. It seems like such an uncommon way to approach an ear infection, right? But really, it's trying to reduce that inflammation in that ear canal altogether.
From an emergency standpoint, what are the dumb things that dogs and cats do that wind them up in your surgeries?
Oh, man, eat everything. If you think that a dog won't eat it, they probably did. And I hate to
Honey,
say
where's the vacuum cleaner?
Yeah, exactly. I think my favorite x-ray was an army man, one of those little
the green
GI
army?
Rangers. Yeah, and you can literally see him charging in the middle of the intestines with his baton up in the air.
What do you do with that? Just wait for it to
Unfortunately, it is surgery. So in certain situations, we can wait for it to pass. But I would say the majority of the time, what's safer for the dog is to surgically take it out.
I would guess if you have sharp edges and ways to perforate through the intestine system and everything else, it's probably a risk.
It is that risk, and then it's also, we have a lot of twists and turns in our intestines with different valves. And so once it gets to that twist or that turn, it's not going to move. And so we know that depending on where it is or how far it's gotten down the intestines, a pretty good chance of whether this size of whatever we ate is going to pass or not. And so surgically taking it out is just going to minimize how much care we're going to have to do.
In a situation like that, I bring my dog in, he's eating my kid's G.I. Joe, and you're like, oh my gosh, he's in pain. We take him back, we do x-rays, and you say, oh yeah, he ate the G.I. Joe. He ate the artery man. Can you then, do you do the surgery then at that point? As far as, obviously the room has to be available and stuff like that, but are you able to get them in very quickly like that, or is that more something like, okay, here, take this Valium and come back in the morning?
So it does depend on, the day, the caseload, whether someone is using surgery, but really it's focused on what is best for the pet. So if we feel that that pet needs overnight hospitalization, then we're probably going to refer you over to the emergency room where they would do the surgery there and then keep the pet for overnight monitoring. If it's a stable patient that can, have an in and out outpatient surgery, then yes, that is something that we could try to facilitate here.
But most of the emergency stuff, is that mostly outpatient, do you find?
That we're seeing?
Yeah.
I would say most of them are. So like chocolate ingestions are a big one, come in and we'll spend the day on some fluids. We'll make sure that we're nice and stable before we go home. Those are the easy
carpet
ones.
things.
Yeah. And the other thing with, talking about eating things, if we have a dog that just ate something, a lot of the times I can get it back up by just inducing vomiting. And so if we see an animal eat something that you're like, ooh, that's a little big, like a sock or underwear, those are the big ones, okay. Bring them in immediately and we can induce vomiting with a medication and save you that surgery or that trip to the emergency room.
What is the fascination? I mean, you've got experience with dogs here, but what is their fascination with dirty underwear and dirty socks? They never go for the clean ones, okay? They're always... What is the fascination with it?
I'm sure it's the smell, right?
It's just something. Oh, this
probably
is
as delicious as their poop they're going to eat outside. So.
I don't get that one. Don't get that one either. I have no idea. What would anybody that's listening to this be surprised to know about Hoffman Animal Hospital? That's what's unique about you that we don't know?
I think what's really unique about Hoffman Animal Hospital is you have doctors that are really focused on that fear-free aspect. You're not going to find that in every practice that focuses on that visit from the beginning to the end, that really want to try to help the dog or the cat to not be scared of us. We want to be here because a puppy coming in, if we create a bad experience for them and they are very terrified of the vet after that, it's only going to propagate and get more scared. And then sometimes we get to a point where we can't even touch the animal because they're so terrified that they're reactive. And so our goals are trying to prevent that from the very first time that we meet you and your pet, is to find out what are their triggers or tricks that really help calm them down. And so we'll have that conversation with you to see what best treats they like, how do they like to be handled, what are their trigger spots. Oh, he hates his paws touched. It's like, all right, well, let's work on desensitizing him with his paws, and that way every time he comes in for a nail trim, this isn't going to be a traumatic event for him.
Cool. Now, when animals need medication, you guys are sort of a pseudo pharmacy as well, right?
That's correct. We carry a fair amount of medications here in hospital. We also have an online pharmacy as well. So we utilize what's called VetSource, where we can help you get that medication even shipped over to your house. And so that is a really helpful for some of these animals that are on medications recurrently every single month, that we can just create regular shipments to the house so you don't have to come in here.
Oh, that makes it easy. So, I mean, if I'm coming home and you give me a bottle of antibiotics or whatever it is, and I need to follow through for 3 weeks, you can have it shipped directly to me?
Yep. Yeah, we can have it shipped directly for the follow-up.
Okay, yeah, I guess that makes sense for some of these animals that are on, like you said, the recurring things, that be able to get that there as well.
Right.
Is this still privately owned, or is this a...
It's a good question. So it's actually owned by VetEvolve. So VetEvolve is a small corporation that owns several practices in the Maryland, Pennsylvania, Delaware, and Virginia area. Okay. And that was one of the main reasons I actually joined Hoffman, was because of who owned this practice. They're small, they're still very family focused, and they want to make sure that we maintain our autonomy here. So they're there to help us with the back end stuff. So things like HR, things like help with supplies, or getting supplies and getting different contracts with different vendors. But when it comes to the everyday decisions that are made here, it's made by myself and Jen Pollock, who's our hospital director.
Let's get into the fun stuff here. Okay, how many animals do you see in a day?
I would say about 20 to 30 patients, yeah.
What's the breed du jour of dogs?
You mean...
I mean, are doodles still the thing?
The doodles are still a thing. I do think I see a lot of doodles, but labs and golden retrievers are pretty popular around here.
Those are they're the happiest dogs. You never see a golden that's not smiling.
That's true.
I had one when I was little, and he had some kind of a bad allergy or something or other, but we ended up having to shave him. Mm-hmm. And I've never seen a sad golden, but I mean, he looked sad, but he really felt he wouldn't come out of the garage. Oh. It was just like, this is beyond emasculating.
Yes. Yeah.
I can't do this. Here, I'll just swing my butt outside of the garage and poop out of the garage because I know I'm not supposed to do it, but I'm not going to go see my friends. Goldens are wonderful. Are the doodles still pretty huge?
Yeah, no, I think that they carry a lot of really great characteristics, right? They are great for families that have allergies to dogs because they don't have that dander like other dogs do. And then the other thing is they don't shed very much, so that's always like a plus.
And they're smart.
They are smart.
My girlfriend had one, and this dog you couldn't lock her in anywhere. It would be like, okay, well, I'm going to turn this round doorknob and go outside, and you'd have to lock the deadbolt to get in. She would close the door when she came back in.
Oh my goodness.
Put muffins in the microwave. That worked okay for about 3 months until she figured out she could get up and push the button and the door pops open, and it's
like I said, they'll eat anything.
they'll figure it. And the muffins, so you always had to buy the muffins that were dog.
Yes.
Even though you had no intention of doing it. What is some good advice? I mean, I would love and we all would love for our pets, our family members, to live forever, or at least outlive us, because it's always so hard, when they've lived a good life and having to put them down, or maybe an illness or something like that. But what's the best advice to a pet owner to make sure that you are able to give your family member, your four-legged furry family member, the longest life that they possibly can?
So I think it's twofold. One is to ensure that we do preventative care, so we keep up on our prevention vaccines. So those are diseases that are very preventable, right? That we can make sure that they're not going to get sick because we can give them these vaccines. And then the other part of it is the screening. So when we come in for yearly screening, we're doing a complete physical, but we're also probably going to recommend some blood work and urine. And that's really to screen for any underlying diseases that just might be creeping or trending a little bit higher, so we can get ahead of the animal becoming sick and sometimes preventing really big problems in the future. The second part of that is, pet insurance. So put a little plug in for pet insurance. So in order to make sure that they're going to live that long, healthy life, it sometimes becomes financially burdensome for some people. And so really starting that pet insurance when they're young, when they're healthy, and when the premiums are going to be the lowest per month and usually stay low as they get older, versus now they're a lot older and they have pre-existing conditions and that premium is going to be really, really high.
My daughter has 2 dogs. Her boyfriend has 2 big dogs, and I think they're both psycho, but to have all that many. But she also did get the pet insurance, and she had one dog that had to put down because there was a brain tumor that came in. But again, the pet insurance, saved it to be able to do it. I think it was through some Visa card or something, and you put it all through some Visa card.
Exactly, and it just takes that decision away of, do I have to do this because my animal's really sick, or do I have to do this because I just can't afford the care?
Well, it is. And I was reading an article yesterday in Vox that was talking about the nationwide issue of animals being turned back into shelters. And a lot of it is, COVID related, in that, hey, we're sitting at home, let's get a puppy, let's get a dog, let's get a cat, let's, get a llama, whatever the heck it is. And now all of a sudden it's like, oh, this is a commitment, or we have to go back to work now. We can't work at home, so we don't have, and their shelters are just overrun. I know the SPCA of Anne Arundel County is overrun with animals. I mean, they're doing the best they can to get them out as well. Are you an advocate of adopting from or rescuing?
I think it depends on the family and the situation. And that's something that we can definitely help with here. So even if you don't have a pet, I'm happy to sit down and talk with you about which pet might be best for your family based off of your lifestyle, based off of the amount of exercise you can give them, and then also what your needs are. And sometimes that conversation really prevents a lot of that rehoming that you're talking about, where we think that we want the extremely active or German Shepherd, but we just can't do 8 walks a day. And so having that conversation with your veterinarian is very important to ensure that this is going to be a best fit.
Well, we do speak with the SPCA quite a bit, and some of the stories I hear about why animals are turned back in, and it just breaks your heart when you sit there and you. Just yesterday, it was a Maltese poodle mix, 7 years old. They got it with a puppy, and the couple was never married, but they broke up, and they couldn't agree on which one was, and I'm like, that's heartbreaking.
It's heartbreaking for the dog, but also for the dog parents, right? Nobody wants to give up their pet. So yeah, trying to prevent those situations, and also just being here to help support during some of those situations too, to be creative on how maybe we can keep that pet in your home.
Do pit bulls get a bad rap?
They do get a bad rap, and I think unrightly so. So with some good training and conditioning and sensitization, we can have a really good pet there.
I think that's true with any pet.
Exactly.
I'm admittedly somewhat leery of pit bulls. Not afraid of them, but just leery of them. I am probably more afraid of chihuahuas.
I was just about to say that. So,
and I am the pit bulls.
And, I think unfortunately they get a bad rap because they have such strong jaw bones and jaw muscles, And so those strong jaw muscles are going to just cause more damage than your little chihuahua, who might actually be a little more aggressive.
Well, and also you typically with the American Staffordshire, is that what the formal name of a pit bull is? I mean, they're beefy dogs. They're strong dogs. So, I mean, it takes a lot to control them. I mean, you've got to have somebody that knows how to handle the dog, and the dog needs to be trained too. And unfortunately, a lot of, they're used for fighting, and they're used for protection and the whole 9 yards. And some of them are trained to be a little bit more aggressive, or not trained to be not aggressive, I guess is what I'm trying to say. Yeah. But with proper training and care and love, it can be turned around.
Absolutely. I've seen the biggest teddy bears of a pit bull as compared to some others. And we have some really great training different programs as well as individuals in the Annapolis area. And so that's another one too, that if we're having issues with behavior, or if we're having issues that are causing owners to want to consider maybe rehoming because of behavior concerns, as long as it's safe to continue in the household, but we have some great resources for training for owners as well.
That's awesome. Can people be cat people and dog people?
Yes.
Together?
Yes, of course. No, we have a lot that will come in, and I'll see both the dog and the cat in the room at the same time. They're best of buds.
And what are you?
What am I?
Are you a dog person or a cat person?
I am a dog person, so I do love my German Shepherds.
Shepherds are great. I grew up with them, and okay, not the most politically correct story to tell on this, but when I was growing up, we had a German Shepherd was actually a reject from the police department, so he did some training and stuff like that, but it was hip dysplasia, and they were just not going to put him through that, so they just sort of rejected him, and we adopted him. He was great. He had all the training in the world and everything else. My parents were divorcing. My dad came home, and my sister and my dad got into it, and I'm like probably 5 or 6, and my sister for some reason calls my dad a bastard. My dad's like, okay, that's it, girl, you've had it. She runs up into their bedroom. She's pushing the furniture against the door and stuff like that. My dad's trying to break down the door to get into her and going to lay one right across her butt.
Oh, my goodness.
As he's getting in there, he locks the dog in the bathroom, and my sister's there, and she's just about to get smacked on the butt, and she's like, John, let him out, let him out, let him out. And I'm looking, and I'm going, but Lisa, you're a jerk. And to my sister, and then I go, but you know what? If that was me, I'd probably want you to open the door and let the dog in. So I opened the door, and the dog came out. My dad was literally just about to smack her butt. The dog comes up behind him, in between his legs, just closes the mouth. It wasn't a bite, and backed up. And it was like, I'm in control here. You're going to come back here with me. We had one when my kids were younger too, and I remember coming in at 1 o'clock with 2/3 of my kids. One was homesick with my ex-wife sleeping, and the dog always slept on the landing of the house, because it was, if you're leaving, you're going through me. If you're coming in, you're going through me. I think that was the mental. And she lost track, and anyhow, we come in, and she goes flying down the steps, and she's squatting out. She's sort of snarling, and I'm like, shh, shh, shh. And she said, oh, God, thank gosh it's you. And so we all go to bed. The next morning I go down, there's this big, huge puddle of pee where she was doing her snarling. So I'm sure she's sitting there going like, oh, no, I've got to do dog stuff. What do I do? What do I do? They're just such wonderful dogs.
They are, and they're very loyal. And, I'm a prior naval officer, and then my husband was a prior Marine Corps officer. And we got to work a lot with the military working dogs, which is, I think, where a lot of our love came from for the Shepherds. I've
got to also, we're getting way off topic, but some of the dogs and the service dogs that they can do are amazing. I mean, my friend of mine is the fire marshal for the county, and he's got an arson detection dog. And I saw a video one time where they threw a match in the middle of a field, just a match of a cornfield or something like that.
Yeah.
And I dropped the dog off, and I was like, okay. And it was just like, boom, boom, sat, and within about 2 minutes found exactly where the match was.
Right.
And there was a girl in Severna Park that had some sort of a narcolepsy thing and it wasn't narcolepsy because she was tested, but it was, we could be talking just now, and all of a sudden she'd go pass out and go down. She was going to school in Colorado, which wasn't the best place, with mountains and stuff like that. But it could be walking in the middle of the street. It could be eating dinner. It could be hiking. It could be in class, just out cold. And they found a dog that was able to train, and the dog went through like 20 weeks of training, and then she went with 8 weeks of training to this thing. And it's amazing. I mean, she walks with this dog everywhere, and it senses an episode coming on, and it just nudges her in her thigh, and it's like, hey, girl, sit down.
Absolutely. Yeah, we have Dog Training Elite is a local training program for service dogs, and I've worked with them, and they have done phenomenal things where they've trained hundreds of dogs that are for diabetics, and they can actually let you know when your blood sugar is too low, alert you of that, so you then know to go and find treatment for yourself.
Dude, eat an orange.
Something like it's so
That's
cool.
Awesome.
Yep.
That is awesome. Well, Dr. Muller, thank you so much for your time today. Wonderful practice. I'm really kind of psyched about the fear-free thing. That is pretty cool to see how that works.
Yeah.
And the capabilities here at Hoffman Animal Hospital, and again, its website is Hoffman, HOFFMANAH.com. If you go out Route 50, you do see them on the left side if you're heading over toward the Eastern Shore, just before the BMW and the Mini dealership. Really easy to get to, right off of Baydale Drive. And if you are looking for a veterinary practice, come check them out. That's for sure.
Awesome. Thank you so much for having me.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.